Good morning, ladies and gentlemen. Thank you all for joining us this morning. My name's Scott Armstrong. I'm the founder of mentl, and we're recording this morning for a very special live edition of the Mental Space podcast that we do. So for all the people that tune me in, this is a special episode which is recorded at Abu Dhabi Global Healthcare with an invited audience of experts and intellectual people. Everyone in this room, I think, belongs on the stage, but we do have an amazing lineup of speakers. Just to let you know about mentl before we get into proceedings, I started mentl 3 years ago, and the inspiration for that was the loss of my father. He was a very successful CEO, very strong man, but was struck down by depression. And once he struggled with that, within 3 months, we lost him. He was unable to talk to his family. He was unable to talk to me about his struggles. And after he passed, I was determined that we should have more conversations around mental health and try and move the needle and tackle the stigma. So today is part of our Tear Away the Silence campaign, which we have been running to take the conversation out into the community, kindly supported by Viatris. This is the latest and the greatest episode that we've done so far. So thank you all for being here. For me, as a mental health advocate that's been trying to change the conversation, it means so much to me, and I'm sure my father would actually be proud that so many of you joined us today. So without further ado, I would like to begin the proceedings for the podcast. And please, if we can welcome our first guest to the stage with a keynote speech, Dr. Zain Al Yaqban, the CEO of Sakina.
So, this is an important topic, and there is no right time when every time is the right time to try to address, to try to make a difference, make a change, to improve mental health in general. It's a critical issue, and especially youth, children, or future generations. Everybody is aware that there is always an increase in mental health issues in these age groups. So it's even becoming more and more important. Destigmatizing or reducing stigma, breaking barriers, early access care is all important initiatives that we all need to collaborate to work with. And again, this is not an individual effort. This is actually a collaborative. I always like, the vertical versus horizontal. In mental health, maybe in other disciplines, it's all vertical. It's all about a single condition you treat and that's it. Mental health is a vertical. It involves every single stakeholders across the entire community. So and will come to us as a provider, but from government authorities, either be it the health regulator or social regulators or the educational regulators or the police, every single entity or authority definitely has an impact, an important role. And then comes our role as a provider, how we can work with these entities. What is our role? How we can collaborate together, because no matter how much we do, Sakina or any other entity, it's always going to be a single effort targeted toward maybe a limited population. But when we collaborate to reduce stigma, the impact will be much bigger, and inshallah, the impact is much higher. Sakina, I think, if not all, most of you guys, it was launched mid last year. Although it's a new entity, but in terms of service, it's been available for years and years, decades. Our main mission is that we provide access to everybody without any structural constraint. What we do at Sakina is different from any other provider, mental health provider. We're not a single silo entity. We're an integrated mental health facility across the entire network. Again, this is the privilege that we are or existing within Pure Health and Saha. So we have locations across entire Emirate of Abu Dhabi, from Abu Dhabi main island to Al Ain to Al Basra region. We build our pillars around awareness and prevention. And again, this is one of the most important pillars because it's about early prevention. It's about how to make the community aware that these services are available and how maybe understand what needs to be done. Clinical excellence, again, it's so this is the core of why we exist. This is the majority of people here. I'm not a clinician, I'm not a psychiatrist or psychologist. So we own it, you guys. You guys are the one who drive this profession, so thank you. Rehabilitation and integration, again, what we do is not only symptom control, it's more about functional recovery. It's about how to always say this, how at the end of the day, it's Zain, it's our kids, how can we be functional? How can I benefit my community? How can I benefit myself? How can I benefit my family? So this is the main or ultimate or objective of treating an individual. Not only treat them for the symptoms, but no, reintegrate them back into the community so they can support and have a good quality of life. We are the largest in terms of geographical distribution. We exist almost across the entire Emirate of Abu Dhabi. We, again, part of our unique services that were not the single mental health facility, but rather than integrated across all medical disciplines. And again, this is part of the main messages that we're trying to convey to the patients, that treating your mental health and physical health should go hand in hand. That's why we try to have presence in every single primary healthcare center. So if a patient goes to a family medicine, to a neurologist or whatever, they should understand that it's normal. My next door is a psychologist or a psychiatrist, so it's my right. So it's okay. Today I visited my ENT doctor, tomorrow I visit my psychiatrist. So this is what we want to do. The same thing, it's not only about the primary healthcare centers, we exist within hospitals. So maternity hospitals, Corniche hospitals, we have our services there. Pediatric services, SKMC, did I miss anything? Tawam, Al Ain. Basically, the message is that we are located across the entire network of Pure Health and Saha. Comprehensive service, again, we own it to Tadim. We are expanding to the services that we have. We're not going to go into details, but we cover the entire scope or catalog of services that a patient or an individual needs, either from inpatients to children, adolescents, to digital, to home care, to satellites, home care, and we've been running it for years and years and expanding it. We have 4 home care services, 2 in Abu Dhabi and 2 in Al Ain. We're introducing or adding this new service as well to Al Dhafra. Inpatient, we have it in Abu Dhabi, Al Ain, and we're adding inpatient to Al Dhafra. Sakina for children, we have dedicated centers for children and adolescents. And what the last slide or part of my presentation is, again, this all, as I was mentioning in the beginning, how to reduce stigma, how to create or make access to individuals. So in addition to the physical face-to-face interaction, which is very, very important, but you want to, again, just we'll take it maybe step. Changing culture and changing behavior does not happen overnight. It's not a switch where you turn it on and off. So changing our perspective and how we think about mental health, yes, we should drive it aggressively, but at the same time, prepare the right infrastructure for it. So in addition to our physical expansion, we also, and actually yesterday we just launched it, we are launching our telepresence. So through Pura, we're offering teleconsultations through telepresence for all psychiatrists and psychologists. And in addition to that, we'll have a mental health application for self-support. That's it.
Perfect. A round of applause. Thank you so much. Shukran jazilan. What I love as well is how you're talking about physical health and mental health going hand in hand. I think that's the mission, that's the vision that we can get to. Please, once more, thank you, Dr. Dave. Thank you so much. Okay, and our amazing speakers continue at a fast pace. Please, perhaps needs no introduction, but our next keynote speaker is, of course, Khulud Al-Omyan, CEO and Editor-in-Chief of Forbes Middle East. Khulud, welcome.
Good morning, and thank you, Scott, for having me here today with you. And I'm sure we are here today, all of us, to supporting mental health, and we are in the same room, in the same page, and all of us, we have passion to supporting the mental health care. And thank you for Sukaina and for all the team in Sukaina. And this is something يعني يثلج الصدر. I don't know how to explain it يعني, but it's make you really proud of what Sukaina and the government doing for us. I would like to thank you so much for being with us. And let's start. I'm here today not because I'm like the CEO of Forbes or because and the editor-in-chief. No, I'm here as a personal, because I remember when a year ago when I had the breast cancer. I remember when the doctor told me, you have a breast cancer. I said, I been in this moment. Honestly, I can't explain. It's something. It's depression. It's cannot explain my feeling. There is no feeling actually. Honestly, it's numb. I been for 1 month numb, nothing. Even I cannot cry. I don't want to talk to anyone because I swear to God, something it's shocked. Then I decide to break the silence and inform my family. Okay, the best support we can get from people we loved, who is people around us, our family, our relationship, our friends. So just we are here to break the silence. Let's speak up. Let's support. Let's not judge anyone go to the psychologist or doing or having any medication for depression, or just to be kind to others, kind to ourselves, kind to our family, kind to our friends. Our life should be we enjoy everything. So we enjoy the colors, we enjoy the sky, we enjoy the butterfly. This is the normal. This is the normal. We have right to enjoy our life. Depression will, and all the mental health will, it's give our rights away from us. So let's. I want to talk about the media because I'm in the media, and we want to see how is the media supporting the mental health. Let's read this, and please read it with heart. We don't want to go ahead with like stop, be hurry, fast, move. We don't have time for everything. Let's enjoy even when reading something. Taking care of our mental health is not a weakness. You understand? It's really not a weakness. When I'm saying, guys, help me, I need help. It's not weakness. It's nothing to be ashamed of. We have right to ask help. It's what help us to be strong and balance. For whom? For ourselves, for our family, for our community, for everyone we love. So let's see inside how is the world really struggling. It's really serious issue. It's crucial. It's the global struggle with depression. Depression affect 280 million people worldwide. It's something big. And women, sadly, women are 50% more likely experience depression than men. So what is the reasons? What is the main reasons? Sometimes unemployment, trauma, or loss increase the risk of depression. It's a lot of events in our life. Scott talking about his dad, I'm talking about myself. Everyone has a story. I'm sure everyone has a story. And this is why we are here, to break the ice and to break the silence. This is the alarming insight from here in the Middle East. The global 280 million, and let's see Middle East, our region. And you know, our region, it's not something new. We are suffering with a conflict, with a lot of events, with a lot of conflict in the region. The individual experience mental challenge in the MENA region, 79.32 million. This is 2024. And projection for 2029 maybe will reach 98.2 million. Anxiety and sleep disorder. You know, like about the sleep disorder. I wish it's like when we have anyone on the family have sleep disorder, just be gentle with them. And you have to understand they need help. The estimated number of the anxiety and the sleep orders, 49.78 million individual projected for 2029. I try to make research to find the self-harm or related death or suicide if the people youth. And the last information I had 2019, with 4,000 people in the MENA region. It's a big number. It's not let's have good news. The good news is, regardless with all the challenges in the region and the war and about Gaza, Libya, Yemen, Syria, all these countries, conflicts, Sudan, any conflicts in the region, in the Middle East, we have good news. We have light somewhere. Inshallah, this light will be bigger and cover all the Middle East, which is, we have a growth, 402 annual growth, which is in the Middle East. It's making a growth in the treatment. It's the growth. It's the mental health care. It's become something. It's like spotlighted. It's like everyone start looking for this point. It's very important. We will see why. We have today. We all of us here in this room. I see in your eyes. I see in your feeling. I feel your energy. It's like we are passionate to supporting this mental health and to create awareness. And this is what we want. Also, government, supportive government policies. There is the government to start in the region, especially in GCC, starting take care of build policies for the mental health. And this is, which is, it's amazing. You will not find it anywhere. Better healthcare service. We have, alhamdulillah, Sakina. We have a lot of care. And inshallah, one day, insurance also cover the mental health services, because this is big issue. Still, we don't have the insurance. They not consider this more important than longevity, or I don't know. It's the mental health is like something. It's the foundation. That it's, I don't know. It's our core. Okay, this is how depression affect individual and communities. It's, imagine why we talk about mental health. It's because our relationship, our family, our work. Starting, if you see the people who is suffering from depression, they start sometimes going for alcohol, sometimes they try to smoke, and sometimes they going any kind of self-harm. He just to be away from any way. They start with shy to ask help. If we don't ask help in the early stage, it will be in the last stage, but pressure on healthcare system because increasing the demand. So eh, let's be like gentle with ourselves and with others. Where do we go from here? There is a lot of a question in our head. We should understand it is something, it's big, we should deal with it. What we can do, let's read again this. Okay, let's break the shame culture. The shame culture, it's nothing shamed of. Okay, if I am, I cannot survive without, like, during my medication and during my I cannot survive. I cannot. It's like without taking medication of mentally, it's something help me to stand in my feet and talking to others. So it's normal. It is not something I shame. Let's break through the silent wall. Healing begins when we spoke, connect, and support each other. Okay, breaking the silence, how media can lead. It's like, I am sure all of us watching movies, and always on the movies we have, it's very rare to find a story of someone like have mental issue. It's always he is bad guy. It's very negative story. It's very negative image. It's in all our subconscious about mental health. It's even sometimes if we know someone going to get any kind of a treatment, or we insidely judge others, which I wish we don't. It's like, oh, he is majnoon. He is like have something. Oh, kuku kuku. No, 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 it's something. It's really like flu, like anything else, you know. Again, what channels can raise awareness to break the silence? Okay, social media. We all in social media. It's social media. It is the kind of يعني it's everyone in the social media. We should help to supporting more content, to sharing our experience, to supporting others, to not judge any others, and also the newspaper, print, and broadcast or podcast, and technology driving access and awareness media. And technology today, it's supporting us because it's accessible, and it's also easy to do any consultation, a treatment, a consultation from your home, you and with the more confidential. And if you don't want to have this consultation in your country, you can have it abroad with other country, and you can. It's the technology. It's really supporting the mental health, and it's something topic in the future we can discuss. Okay, it's the depression or the mental health or the anxiety, something, it's not selective. It can be hit anyone, from royal family, from entertainment, from celebrity, from media, from business, from politics, business, everywhere. it's it can be hit anyone, anytime, anywhere. It's not something, it's can be, oh no, I am safe, I'm strong, and it's coming shocked. It's coming without sign, coming suddenly. And maybe sometimes yani it's like start become bigger, 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 like snowball. So the good things and the good news, it's like I'm sure we all have respect for this lady Oprah Winfrey, because she's hosting the show. She's starting talking about a lot of taboo area or taboo some stories, and she inviting a lot of people talking about this topic, and also Richard Branson, who is talking about ADHD, and Elon Musk and Lady Gaga, Prince Harry are talking long story about emotional pain with the experience after losing his mom, and Selena Gomez, and all these people. The good things, it's we start breaking the silence, and we sharing our stories. It's nothing to shame of. Okay, how Forbes Middle East supporting mental health internally and externally? As a Forbes, we do a flexibility with the work. We let our team working from the moon, from anywhere, just to tell them to be with their family. Because I noticed one my colleague, they has always feel guilty. He's spent 10 hours in the work, and he has guilt. He cannot spend his time with his family. He cannot see his kids. And then I said, listen, guys. And one of my colleague also had a breast cancer. She told me, I miss my family. I said, listen, go to UK, go to your land, go home, go anywhere. Just inshallah, you work from the beach. I don't care. Just enjoy your life, enjoy your work. It's like, if you want to move for Forbes, it's our policy internal. And we also cover any mental, because the insurance not cover it, we cover. It's like internally, anyone has booking any treatment or the consultation, we cover that. And confidentially, for sure, we're not showing. We host also with Pure Health, we have healthcare leaders summit. We discuss a lot of topics. We have health with American Hospital Medical Tourism and Wellness Summit, which very focusing in the wellness summit, in the wellness. Why investing in mental health makes sense? Imagine 38.8 billion revenue from, if we invest in mental health, the revenue of the industry 38.8, and the loss can be 1 trillion if this is if they missing the work and because the depression and anxiety. Invested $1, the return $4. And it makes sense for governments, for companies, because as a Forbes, if I invest, it's like a small case. If I invest in my team mental health, imagine it's like I love my team. They work like they are home, they enjoy it because we have right to enjoy. It's like enjoy starting from home, work, from everything. And the good things, call to action in the Middle East, and especially in the here in the countries, because I believe media, private sectors, and government, and individual, and every one of us, we are ambassadors for to having to supporting mental health. And example in UAE, they have government's national policy for the permission of mental health, promotion mental health in very campaign. And now we have Sakina, and we have in Masr, Egypt, supporting also 2024. They start supporting with a lot of campaign. Your health is happiness. And also in Saudi Arabia, Saudi start also a promotion. They promote healthcare in everywhere, and they do campaign and do training and do course and everything. This investment in the mental health, it's for long term and impact. It's for long term impact and sustainability. We don't want just make it as a mental health, because as we care about longevity, extremely for longevity, this is again, this is the base. This is our core. Mental health is not just a personal issue. It is a community investment, a workplace priority, and the smartest strategy for the future. Let's not just start the conversation. Let's lead it. Thank you.
Thank you so much. And I'm glad you're a famous figure who is speaking up for mental health. Before I started Mental, for 33 years, I was a journalist and worked in the media. That's the first time I've heard an editor-in-chief talk so openly about mental health, so congratulations. Next, we move on to our panel session and an exciting discussion. So please, a round of applause for all of our speakers as I introduce them. But of course, I would love a very loud round of applause for Her Excellency Dr. Omniyat Al Hajeri, the Executive Director of the Abu Dhabi Public Health Centre, who, like Dr. Zain, has been incredibly busy during this conference. So we are so grateful for you for making time to join us today. You're very welcome. Please, and your microphone should be ready.
Falls any rescue missions.
And please, a round of applause for our next speaker, Hein van Eck, who is the CEO of Mediclinic Middle East. And another champion of mental health and physical health, please welcome David Headley, who's the CEO of NMC Healthcare. Finally, we turn to two clinical specialists as well as speakers. First, please, a round of applause for Dr. Sama Makhoul, CEO and consultant psychiatrist at Ream Neuroscience Center. And finally, Dr. Vidrana Ladina, a great friend of the mental space, UAE country director of the Middle East Psychological Association. Thank you so much. Okay, now it's my turn to find a seat. So I'd like to begin with a question and go down the line and come to all of you, which is it's kind of like a helicopter view, just to ask where we're at. And Dr. Omnia, maybe I start with you. We heard from Dr. Zain earlier talking about physical and mental health needing to go hand in hand. Have we progressed to the time where we're thinking about that? And are you seeing it in practice? And if we're not seeing it in practice, how can we address that?
Thank you for the question. First of all, I'd like to thank everybody here, especially Dr. Zain. It was a grand entrance. Thank you. And it's amazing to be part of this highly motivated, leading the future for better mental well-being for all of us. This is a pain point question, because the fact is we do recognize this for so many years. I've joined public health in 2012, and one of the first programs that we started working on at that time was trying to raise awareness in mental health. And unfortunately, the progress is very slow. In public health in the Emirate of Abu Dhabi, we strongly believe that we have to build communities that are strong and healthy, both body and soul. And trust me on this, working as a clinician, I've seen people that are suffering much more from their soul pain than actual chronic disease that I have to treat. Most of it was very closely linked. The reassuring thing is we have full strategies that are focusing on this. And I don't want to talk a lot about it now. I know this is the helicopter view. There will be a second question. So I'm saving some of the answers to that.
Excellent. Well, thank you for that. Hein, I could see you nodding in agreement as well as Dr. Omniyat, Her Excellency, was talking there. Again, physical, mental health, obviously within Mediclinic healthcare situation, you're seeing both, but are you seeing it go hand in hand in practice?
Yes, absolutely, Scott, and thank you for having me. Always hard going after the rock star in the entrance. Wonderful to see the excellency. For us, certainly, physical health and mental health very closely linked. I think it's certainly not a surprise that many people who struggle with a very severe disease have got mental health issues. But I think the opposite direction is an even bigger problem. Where people with mental health issues then later develop very severe physical health conditions. But we are seeing really good progress. You have to change the culture. All your physicians throughout your organization, it's not just the work of your mental health physicians or even only your primary healthcare physicians. Everybody needs to understand we need to look proactively. How do we screen? How do we ask the right questions so that we pick up early on the issues out there? So it's really a culture change that we're pushing in the organization.
David, I'll come to you as well to carry on that thought around that culture change within a healthcare organization. You're a very experienced leader, worked in the sector for many, many years, and we've had conversations about mental health. So I know you feel this passionately. But again, that helicopter view, where do you think we're at? And within your organization, how can we get that culture change that Hein is talking about?
Yeah, first of all, thank you very much for inviting me, and thank you, Your Excellency, for joining us. I think events like this, obviously creating awareness is very, very important. We need more of these events where people speak out. And I was very impressed by the speakers earlier on, openly talking about their challenges and yours, of course. And we need more of that from leaders. And I think as an organization, we don't spend enough time on mental or physical health, actually. A lot of it is on reactively addressing issues that come into hospital doors, and we treat the actual disease. And we don't focus on the preventative side of the well-being. We don't look at the mental health early on. And I think integrating mental health in the continuum of care, in the patient's pathway, is very, very important as an organization. And we need support from regulators, and I know there's a lot of work in this regard, and from the insurers as well. These should be prescribed minimum benefits. They should be paying for it as part and parcel of the benefits that are on offer. It's, I think, more important than some other things that are covered. And as a result, there'll be more investment, more people will talk about it, and it'll become a bigger issue that can be, there'll be more focus on addressing the bigger issue.
Fantastic. You're at the coalface, Dr. Sama. Sorry, I'll lean across. Working with patients. So again, from that helicopter view perspective, how are you seeing things change? But what more is needed to affect that change, in your opinion?
I think we're moving forward. So I think, yes, there's this conversation. I think, for example, 2 years ago, Her Excellency Dr. Omniyat was the keynote speaker in our first suicide conference, which was very unusual to have something like this in the region. But I'll go a step forward than what everybody's saying. We keep saying mental health as if it's separate from medical. Mental health is 100% medical condition. It's not 99, it's not 98, it's a brain disease. And that's what people don't understand, when we talk about mental health, because we have a big urban. So what we need to deal with the medical mental health, which is like when we talk about, the number when you show depression, it's 280, actually now it's 350 million ones. 40% of those are treatment resistant. So even when we treat them, because we're treating them late, it gets harder. So it's a brain disease, should be treated exactly like what I treat diabetes. It's exactly how I treat cholesterol. I need to screen, I need to do, I need to.
It's a little early for a mic drop moment, so you've got to carry on.
Yes, but I think what we need to do, I think it's nice, everybody talking about mental health. I think we need to go, we need to, as probably we are the psychiatrists or yourself or people who are fighting the stigma, we need to make use of that. When I get two CEOs of some of the two biggest medical private, facilities here in the UAE, I need to force them to take it seriously and make sure and ask them, how many patients did you treat with depression? Your GP, how many did that? So we need to go a step forward rather than saying yes and making excuses, because it's so simple. We can do a lot. And I think we are better, but we are far from where we should be.
So no pressure, Dr. Vadrani. You have to follow all of that with your helicopter view. Dr. Sam is bringing the perspective from the psychiatry perspective. Obviously, you're with the Middle East Psychological Association. How are you seeing that evolve and the conversation and the awareness around psychology? And again, what are those urgent issues that we need to address?
Thank you for inviting me as a representative of Middle East Psychological Association, also, I guess, representative of all the psychologists. You know, thinking along the side of, being in the Middle East Psychological Association, knowing a lot from my colleagues who are in different countries in the region, how mental health is being treated, seen, legitimized or not. I think, here we are so lucky. UAE is really leading by example. It's a relatively small country in the region, but with a great vision that they're also not just talking the talk, but walking the walk. I'm a big fan of that. I think, what all of my esteemed panelists said is, these are valuable points. What I wanted to add is, when I was reflecting on this, I don't know why, but last week, how much of our work, and I talk for clinicians, is invisible. If you're in mental health, we are just invisible people. Not today, obviously, but that also means that our patients are invisible. Our job is so confidential. We don't talk about it. Our families don't know anything about what we do. We are like CIA agents, right? Like special. We never talk about work. And I think our patients feel invisible with their struggles. So more visibility. So not just staring away the silence, but also staring away invisibility would be amazing.
That sounds like my next campaign. Fantastic. Thanks very much. Walking the walk, Dr. Vadrani says, and I think we can all relate to that after 3 days at this conference. We've all been walking quite a lot of walks and quite a few steps. Your Excellency, and thank you for keeping some of your powder dry. So I actually have a question to answer you. But from a policymaker's perspective, how is Abu Dhabi Public Health Centre walking the walk? How are you working to integrate mental health into the broader population framework?
This is a very important question that took us a very long period of time to actually try and design in the best way. We work collaboratively. So a lot of the colleagues here on the tables, Dr. Nahida, Dr. Samar, Dr. Qadri, a lot of them, we've worked with them since the initial steps, the baby steps of creating our programs. I'd like to assure everybody that there is a bigger framework that comes from the Department of Health that looks into mental health reform. And I'll be focusing on the areas related to Abu Dhabi Public Health Center.
Yeah.
We recognize it fully as a very important disease. And that's why we don't start talking about treatment. We start talking about the importance of prevention, building resilience, embedding it into our screenings and early detection to enable our colleagues, when we start referring to them, to have the best disease management journey. So the whole story is not only about, again, longevity and having people live longer, it's the quality of life that they deserve to have. Thank you. The real target is for people to be happy. I can have people treated for diabetes. I'm an endocrinologist talking about mental health. I'm sorry. So I have to go to diabetes. If I'm treating a person for diabetes, getting perfect hemoglobin A1C, and they're crippled, they cannot have a life, they are hypo all the time, then I'm not doing them any good service. And I think the same goes for every other disease. We have to be really careful crafting the balance between building our resilience, especially starting from a very young age group, all the way through the spectrum. So we've embedded mental wellness screening in many of our programs, including the workplace wellness programs, our campaigns that goes to the public, but more importantly, into the screening programs that go into schools. We've just piloted that for the last year in grade 9, and the plan is to expand that. We started with depression, and we are going to expand it into anxiety before the end of this year. The same goes for our comprehensive screening program. So we screen for cardiovascular risk factors, cancer, and we screen for mental well-being and mental illness. And again, we've started with depression. We're expanding now into anxiety, and hopefully very shortly we'll expand to whatever our colleagues here guide us through and tell us that is important and appropriate to introduce to the public. This will create a lot of noise. So awareness is very, very, very important. And I'm sorry to say, like, throughout our journey, we've never really cracked the barrier of silence. Even when we've done so many campaigns, I think persistence is the key word here, because we go out in campaigns and then we cool down, and we go out in campaigns and then we cool down, and we get people enthusiastic, come and talk about their situations. We've had a person that I highly value his courage. He even came out with us in a video. And he talked about his experience and how did he actually needed help, and he took medication and he improved. And less than 6 months after that video went out, he came back to say, please just take it off. I cannot face the stigma that I'm seeing at this stage. So no matter what we are doing, unless that's actually translated into very well-rooted strategies within workplaces, within our communities, people should not be stamped, should not be stigmatized for this, just like all other diseases. And this is where we need every single individual input. I'm a strong believer in clinicians' leadership. I think administration is a short half-life. People come and go. But it's really the clinicians on the ground that are dealing with those people, understanding their needs, are the real heroes that should keep the push as much as you can. Just keep the loud voice. What's happening is those dips takes people that trusted us down with the dip. And we have to rework through the whole process. But am I happy with where we are going? Fact is, yes, we have very structured programs for the first time. Within Abu Dhabi, we have very strong players within the healthcare provision that looks after this. What's amazing about all of them is they work hand in hand as colleagues, and they don't only work on providing treatment, but they also work on providing awareness, education, support, and reintegration. So we do have the full spectrum within the Emirate of Abu Dhabi, and we have one final thing that we hope as a regulator that we can support our colleagues with. And again, it's a very secretive, very highly secure, very confidential, but we do have a mental health register. And what we are hoping to build in the future is just like any other disease. Now, in diabetes, I have diabetes and pre-diabetes registers. I would like to have identification of people at risk. Because the fact is, if we intervene there, we may never need to go into the rest of the spectrum. And I think just like any other disease, I'm not the expert here, if we detect earlier, our chances of succeeding, returning people to functionality, happy and healthy life is much better than detecting that later and trying to push them into actual treatment. I'm anxious of the time. I don't want to take the time of my other colleagues, but we are using this platform to seek support and help. we as public health have limited resources, but our real strength is in our ambassadors and people on the ground that make the difference. And we are here to open doors. We advocate, we talk to leadership, feel the pain when we talk about coverage. And I reassure you, as public health institution, we advocate for patients, and we are working very closely with our colleagues within the Department of Health, also on improving coverage. But we also talk in a national level to MOHAB and all other entities that are responsible for that. So thank you for having me here and giving me this platform, and looking forward for collaboration with any of you that can actually open a door, make a change. We can build a great future and a lot of hope.
Thank you. I have to say, when you said you were taking the other speakers' time, they were all shaking their heads and going, carry on, carry on, carry on. Dr. Sama, I'm going to jump down to you if I can, just to pick up on one of the key challenges that Her Excellency Dr. Omniyat was talking about, which is that stigma and the stigma that people are facing. How can psychiatry do more, particularly at the coalface, to demystify mental health and tackle that stigma, particularly in communities where sort of medicalized mental health care is still quite stigmatized, still quite taboo?
I think frankly, when we do that, there's, we don't need a forum like this, because obviously, we've done the job, and I think, we can look at a few levels, and if we want to go to actually making a difference, I think we need to start from, primary care. Primary care is, I think we worked, me and Dr. Mahida, on training primary care. Mental health all over the world outside here is treated by primary care. We only, as psychiatrists, we treat like the most complex, difficult one. And, if you look at, let's say, for example, GP practice in the UK, 70% of their cardiac consultation is mental health. When you talk about the bulk of primary care is mental health. When we have GPs and we follow with GPs and we put KPI for them to treat mental health, at least, I can say, with some of the people in this room, we can treat maybe 50% of everything. Moving forward, other than primary care, I think even psychiatrists, I don't think, as psychiatrists, because we've been on the defense, we are struggling. It is the only specialty that when you give treatment, you say, I'm sorry, I have to give you medication. I haven't seen any endocrinologist saying, sorry, I have to give you glucophage, or cardiologist saying, sorry, I have to give you aspirin, even though aspirin is probably 10 times worse than any of our medication in terms of side effects. So even as psychiatrists, we're apologetic that people are unwell. But if you look at the numbers here, if you go statistic, every single person in this room, they have a family member today with mental health problem. And every single person of us here, they are at risk between 30 to 50% in their life to suffer from mental health. So we're not talking about something rare. We're talking about even ourselves, our families. Mm-hmm. But when I go to a doctor who referred to me 200 patients maybe in the last 2 years, and I say I want to give his wife and medications that prescribe 1 billion times on earth, he would say, well, do we really need to? He's the doctor. So I think this is quite big. And the last thing is, and I loved when we have the Forbes people here and we talk about influencers. I think we need to work more with influencers. This is 2025. So if I have to go and with whatever somebody had 1 million followers or 5 million followers, and I have to go and sit with them and talk about mental health and whatever way we need to do that, if that breaks the stigma, I'm happy to do it. We should, all of us will have to do it.
That was the psychiatry challenge that I threw to Dr. Sama. So Dr. Vajrana, I'm going to ask you a similar sort of question. I mean, what is the psychologist's role in building that long-term mental resilience? What do we need to do? And also the distinction, perhaps, well, how do you see that role slightly differently for psychology as opposed to psychiatry?
Yeah, great question. Well, as Dr. Summers said, yes, you may have to sometimes apologize to your patients, but at least you have medication to give, which we don't. We have nothing. We have no magic to offer to people, and I think many times they do expect that from us. Actually, they need to like us for therapy to work. because research tells us that no matter, your other demographic, background as a clinician, you can have fancy degrees, you can, have been trained in the best approaches and modalities, but if there's no chemistry between the patient and the clinician, it just doesn't work. So therapeutic alliance is really important. So we need to establish a relationship with our patients of trust, of belief in themselves, in us. And unfortunately, psychological treatments take time. And nowadays, nobody has time. Nobody wants to take time. Everybody wants a quick fix. So as Dr. Summers said, we do a lot of work in mental health as clinicians, convincing our patients that this is real, convincing them that treatment is legitimate, convincing them that we know what they are doing. Because they come already self-diagnosed and they Googled it all, and they talk to AI. It's wonderful. I'm all for it. But then, there's a lot of unlearning, dismantling of the, misconceptions that we need to do in therapy room. And a lot of discouragement they are getting from others along the way. People telling them, you don't need a therapist, you don't need to go there. What is she telling you? And so I think there's a lot of fight constantly that we have to fight like no other health professional. So I'm thinking, be it a psychiatry or psychologist, and we work hand in hand. We sit next to each other. We do like and love each other. I think there's the misconception that there's some sort of competition. There's no competition. It's just collaboration. But I think legitimizing treatments also among health professionals, legitimizing specific groups of people, such as people who are neurodivergent. Like, I think it's really, like you said, it's 2025. For God's sake, we should accept that some people have different kind of brains that are equally or better functional than, like mainstream brains. Absolutely. And in the room we have people who are fighting the good fight, like Anna Kamitsky with her agency. But it's individual private efforts still. People investing their life savings to give it visibility. It shouldn't be that way. I think legitimizing that norms for what is a healthy individual from perspective of mental health are changing. What it used, what is crazy, what is normal. Do we need those terms even? I think just talking about what are the new norms, new definitions of health. And again, just to conclude, it is all health.
Absolutely.
Difference. All
Absolutely.
health is health.
I think she deserves a round of applause for that one as well, actually.
Hein, I'll tag you in here if I can. And again, this whole debate around physical and mental health going hand in hand and all health. At Mediclinic Middle East, how are you ensuring that mental health is seen as a core component rather than a sort of secondary service?
Thanks, Scott. For us, we look at it almost like a funnel, if you will. So try and picture an inverted triangle in a way. So right at the top is where everybody struggles with day-to-day things. General stress, anxiety, minor depression, the worrying well. I mean, it's really a function of our time. Then you move down that funnel to people who really go into the disease stage of mental health. So for us, in terms of what we're doing, the further you go down that funnel, if you will, we want to capture as many as possible people at the top. It's very, very important to have your feelers out, tear down the barriers, as you mentioned, and make sure that all our physicians has that cultural approach to identifying if people might be suffering. As we go down that funnel, some of the things that we've been doing is like focusing on areas where we know there's a higher likelihood of issues being present. And we've just introduced a new maternity care pathway where our doctors, our OB-GYNs have all been trained to look out for certain issues. They ask specific questions to patients, verified questions. They need to do so in every trimester as well as postnatally. When we identify problems, then of course we have dedicated doctors, psychiatrists who are focused on maternal mental health. And then we're going to start training our nurses, our maternity nurses, to also be able to know how to talk from a mental health and bereavement perspective, formal training in order to make that easier. There's EHR tools we've put in place. So that's an example of further down the funnel. If we move one step up on the primary healthcare stuff, we are big supporters of what the Department of Health and Abu Dhabi Public Healthcare is doing in terms of really bringing mental health into primary healthcare. And there are really three benefits to that. I think first and foremost, it increases the accessibility because the bar is always a bit higher. If you're looking, you feel you need some support, but you don't know how to access the care. Always nice to speak to your trusted primary healthcare physician. Secondly, the stigma is less because this person, you go there, nobody's going to think that you went to go see somebody for mental health issues. And then thirdly, the primary care physician is very well suited to look at the physical and the mental health and get both of them, combined in a better way. So for us, we've worked a lot on a triaging program for our primary healthcare physicians, so that they use the mental and the physical health. These it's not my area of expertise, but the PHQ-2 question we would ask to screen. If that comes up positive, they go to that interview. So all the light mental issues, that screening program will help them to know exactly when do you refer to the psychologist or the psychiatrist. And then last but not least, when we look at that broad end of the funnel, this is the bit where we need to do the most work. This is where things like the platform providers come in. This is the area where we believe coaching, health coaching, that the Department of Health is also supporting, is a very interesting area to look at, because your mental health is a combination of many things. You need to sleep well. Many other speakers have spoke about it. The lady from Forbes wonderfully spoke about how important it is that you sleep well. You need to exercise well. You need to keep your work-life balance, your diet. And today we've become so busy that we don't have the discipline to stick to those things. So I do think there's a place for these health coaches to keep us all on track. And the one thing I forgot, perhaps, for our own staff, to bring down that bar for them to access care. We, of course, like many others, have a EAP program in place. It's perfectly confidential. But we also created an additional fund that pays for mental health care outside of Mediclinic, because often people don't want to go to colleagues of theirs. They don't want to be seen to be accessing care. So we did that specifically because we want them to access the care, even if they go to our competitors.
Hard act to follow, but David, I'm coming to you. We've been talking this morning around collaboration. We've heard about the challenges with insurance. How do you see collaboration shaping the future between the private sector, between the public sector, between the insurance sector? How does that evolve, and how can that help mental health and patients' mental health journey?
Yeah, I think there's been some fantastic comments being made up here today, and I'd like to thank everybody for their contributions to this discussion. Obviously, we all need to work together: the providers, the insurers, the regulators. But we as a community also need to speak, and we need to speak openly about the challenges that everybody are facing every single day. As an employer, we've talked about convincing CEOs. I don't think we need to be convinced. We know that our most important assets are our people, and their mental well-being is crucially important. I think the adoption of technology as well will have a major role to play in this going forward. I, for one, when my wife moans at me, I quickly check on ChatGPT what my response should be, and thankfully I don't get into trouble when I get home. But there's a lot of
You will now.
There's a lot of technology out there that you can utilize, and by utilizing this technology, I think it opens up the funnel that Hein was talking about earlier. It opens up the funnel of access towards health professionals, not necessarily in person, but I think it creates a snowball effect where people are talking more about mental health. They're more aware of it, and eventually they will come and speak to clinicians and the like. So technology is going to play a major role too, and that needs to be integrated into this discussion as well. What is out there? What can people access, and what can they utilize? But we've come a long way, and I think that if we carry on working together like this, it'll become more and more of a normal way of doing things. People will address it and talk about it and deal with it, and they won't be judged. And I think that is essentially what we all need to work towards.
Perfect answer there. So I'm going to come to all of you again. I'm conscious of time, and everyone's been very generous with their time. A question for all of you, which is, where do you see the greatest opportunity to shift the needle in mental health in the UAE? I mean, is it awareness? Is it capacity? Is it professional services? Is it something else? And Your Excellency, Dr. Omniyat, I'm going to hit you with that one first, if I may. She's like, please don't come
That's
to
the
me.
advantage of sitting at the end. It's a very interesting question, but honestly, if it was for me to choose one thing that I would see shift the needle, I think a lot of awareness and education. I think there is a lot of what we are suffering from is based on stigma, based on misunderstanding, misconceptions. If we can address that with a special focus on the younger generations, to allow them to have a healthy progress in life, they are easier to destigmatize than our job with the adults at this stage. But definitely awareness, and then early detection. And apologies to my psychiatric colleagues, referral comes after that.
And as Her Excellency Dr. Omniyat has thrown you under the bus, Dr. Vidrana, I'm going to come to you next, because you're not going to hide in the end. So again, what do you feel is the one greatest way we can shift the needle on this?
I'm a big believer in prevention, especially in mental health. It could maybe put me out of job, but yeah, I would be happy to give up my job if, we were doing more efforts in prevention for sure. And this is for wherever you are in life. Prevention, when it comes to mental health, will always prevent from something else, worsening. And I think more accessibility to specialized care, community-based interventions, meeting people where they are. Instead of them having to figure it out and, going through all sorts of obstacles. And I think just what I said earlier, giving specialized, attention or treatment or care or whatever you want to call it to specific groups of people, because it's such a, big pod to say that, they all, of course, have mental health issues, but specific populations need different interventions. Women are facing, as you know, different issues than men, youth as well, elderly. So, having specific interventions. And I'm happy to say that our friends from Maudsley are organizing a maternity mental health conference soon. And that's just amazing that we can attend that and learn because it's such a big deal. Because, we have people who take care of other people. They also should be supported. And I think that's the key. But there are many efforts made in this direction already. I want to acknowledge that as well.
I'm going to keep jumping around the panel. So David, I'm going to come to you for the thing that one thing we can do to shift the need.
Yeah, I think a lot of the comments that have been made here, I agree with. I think if we can get in early, bullying at schools has a major impact on mental well-being. And, if you look at the suicide rates in Japan, for example, I know you listed some of the suicide rates. It's extremely high with, students that are finishing school and entering, the real world. There's such a challenge out there for kids coming through. So I think if we can get in on the preventative side, I love the idea that we're doing screening. I think that's fantastic. I think if we can do things early and open up the awareness of what's actually out there and understand where we are in terms of mental well-being as a community, a lot more can be done. And then, as I said earlier, I really do think that medical insurers should be paying for this. It should be something that is a prescribed minimum benefit. If they were paying for it, there'd be more investment into it and more people would utilize the facilities and the services that are out there, no doubt.
I felt that that was going to get a round of applause. Hein, can we follow on from that from your perspective?
Yes, I mean, some excellent comments being made, and I certainly agree with David that the funding needs to be looked at. The area that I think would be a great place to also get good traction. It looks like people don't read as much these days. People don't engage with things as much. If the video is longer than 10 seconds, they don't watch it. So it always helps if there's a good network driving a change. And I really believe that each and every physician in our organization, not only the mental health ones, is for me the key. And not only the primary healthcare ones. I mean, you've got, of course, within the broad grouping of primary healthcare, it's the pediatrics. They need to be on the lookout. They need to be trained and skilled up to really look out for issues. They need to know what questions to ask in order to flag it. And then in the right way, coax the family to go and see mental care.
Dr. Sammer as well. Because you were saying earlier, we need to do more.
I think COVID was good for us in mental health. So with COVID, there was more attention about mental health. And I think, we use that, but we need to keep the momentum. And this, let's say, era is a trend. And I think there was a good trend about mental health. We need to keep that. And what I think we need to do is we need to go around and just when we keep the trend. So I'm going to go now every day. I'm going to say, guys, at the clinic, they support their staff and they're giving them to know mental health. Then so that will go to REAM, to NMC, if there's people there and say, look, guys, they're doing that. Forbes is doing that for their employee. Why are you not doing that for us? So when you keep that and we go out and you push, because it's a trend and it's right for people, then people would be forced to deliver that. And after a while, it will be norm. And once normalized, then that's it, job's done.
Job's done. Well, wouldn't that be wonderful? One final question, and before we sort of wrap up the panel session, which is to the room, or indeed to the audience who are tuning into this broadcast, what's the call to action? How do we encourage change? And Dr. Vidrana, I'm going to start with you.
What people can do.
Yeah, the call to action.
Call to action. I think just, seeking treatment early enough or at any point and not giving up. So if one treatment didn't work, then there's a bunch of other possibilities as well. And just, supporting each other. Like you said, not judging, but supporting, even if we don't understand it. We don't always have to understand, we can always support.
Dr. Sammy, your call to action.
Yeah, I think let's think like what they do in breast cancer. So with breast cancer, we all go out, and it's a very sensitive area. Women don't like to talk about that. But then now it's a normal conversation. My kids go to school in pink. I know. People go out. So let's go out, and we say, guys, it is very important. Let's go proudly about it. Let's talk openly about it, and let's just keep talking.
David, you're wearing a pink shirt, so that's quite timely. But your call to action.
Yeah, I think as a leader of an organization or a leader of any department or of any service, we need to ensure that this is high on our agenda, and we need to ensure that our organizations or our departments that we represent have the ability to, are providing these services to our teams, and that we're openly talking about it as an organization, providing these services to our staff nurses, for example, they deal with us every single day, ensuring that they have access to, good mental well-being coaches and the ability to be able to talk about it openly, right from the top, I think will make a massive difference. That's where it needs to start. We all need to talk about it. And as leaders of organization, we need to do something about it too.
Hein, you knew I was coming to you.
Yeah. I would just add something Dr. Omniyat said earlier about we should get away from running a campaign, dropping off, running a campaign, dropping off. I think it's about the consistency, and that should be the call to action. So something that we did recently is we created a Mediclinic Blue, a blue chair in each one of our boardrooms. And the chair is there so that in every meeting we ask the question, what is right for the patient and the customer? It's not just the patient, because when they're healthy, they also are customer. But what we'll do is we'll add a mental note to say what is best for that customer, also from a mental perspective. So from our side, we will focus on keeping that consistency up, and that's our call to action.
Perfect.
And finally, Your Excellency, you knew I was going to leave the mic drop moment to you, so no pressure.
See, I'm always complaining. It's difficult to start, it's difficult to end. But I think I'll take the easy way out. Echoing Dr. Samer, honestly. And it's very interesting that when we've started in 2004, 2005, our first campaign for breast cancer, the logo we've used was اكسري حاجز الصمت, tear the wall of silence. Very similar, break the wall of silence. We've used break at that time, that was more forceful. We were so enthusiastic. And I think the real message that I want to send to everybody here is whatever you do is never too small. I think every little drop adds on, because this is such a big problem and it needs everybody's input, whatever you can do. In many situations, and I think Dr. Zain will identify with this, in administration, sometimes you cannot just do everything. You can't open all the doors. But if you even, just have one seed in the right place, open one door, somebody else can come one day and just make it a full street, and you will have all what you need. Whatever you can do, wherever you are, just open the door, make sure that you are a real ambassador for the talk. And let's walk it together.
Perfect. So that brings our panel discussion to an end. So I would like a massive round of applause, please, for all of our speakers. Thank you so much. And just to wrap up, we couldn't have done this Tear Away the Silence campaign without the support of Viatris. So I would like just to invite, just to say a few closing remarks, Rima Malouf, the Senior Director of Policy and Advocacy for Japan, New Zealand and the emerging markets, who has been a massive supporter of mentl since day one.
Thank you, Scott. Allow me just to take a few minutes to thank Your Excellency and the Abu Dhabi Public Health Center, Sakina, Dr. Zain, Dr. Zanhida, and all the team, esteemed panelists, and more importantly as well, the audience who came from the different parts of the UAE to be with us here. Thank you for supporting mentl Live podcast and Tear Away the Silence campaign. Just one very quick thing. Mental health is something that many people are living, but despite that, it's lived in silence. I think we really did cover this today. And it's not about the lack of awareness or access to care. It's majority of the time is because of the stigma that makes it hidden. So thank you so much for bringing stories from a different perspective. The clinician, the psychologist, the public health, very important contributor, to changing things and tearing away the silence. And thank you for tearing away the silence, because mental health is health. We'll continue this journey supporting this as a global healthcare company committed to improving people's life at every stage of life. And we really believe that mental health is as important as physical health. Thank you, Scott, for leading the way, and all the best in your constitutional efforts.
And you're doing extremely well with the applause, so I'm just going to ask for it one more time. Please, Dr. Vadrana, Dr. Samer, Sir David Adley, Haim from Mediclinic, Your Excellency Dr. Omniyat, and of course, Khulud Al Omniyat from Forbes Middle East, and Dr. Zain from Sakina. Thank you all for being part of the Mental Space Live, and let's keep tearing away the silence. Thank you very much, ladies and gentlemen.